Welcome to our 5 on 5. We're pleased to be joined by Ginger Scott, a Chief Nursing Officer at Community Health Center. Ginger, thanks for coming in. Great to meet you.
Thank you. Good to be here.
So tell us, there's been so much in the news about how much Oregon's leading the way in healthcare transformation. What is all this about?
So Oregon is doing some really exciting work, and the healthcare innovation in the state's Medicaid program is pretty exciting. The Oregon Health Plan is the state's Medicaid program, which provides coverage for the most vulnerable in our state, the poor, children, the disabled. And Oregon has received a federal grant to see if we can do 3 things at the same time. And collectively, these 3 things are known as the triple aim, and it's actually something that's being done all over the country. And the 3 objectives are, first, to improve the health outcomes of the patients that we serve. The second is to offer a better experience to people in the healthcare system. And the third, and probably most daunting, is to reduce healthcare costs. So, and in Oregon, actually, we're talking about Oregon being innovative. Oregon has a 4th objective. And the 4th objective in Oregon is that every Oregonian will have the same opportunity for a good health outcome.
Sure. Yeah, and how do CCOs fit into that, or do they?
They do. So the state has set up local organizations, coordinated care organizations, that are replacing a system that was very fragmented because you had medical care over here, and dental care over here, and behavioral health over here.
Okay.
So the coordinated care organizations are not only coordinating the care of the members that they're serving, but they are also making it easier for their members to access care, and they're able to fund some projects with partners, with community partners, to enable all of us to do better work in achieving these 4 objectives. And in Jackson County, we have two coordinated care organizations, Jackson Care Connect and All Care.
Interesting. Okay, all right, well, we're going to take a quick break. Learning a lot here right now. I know it's a big thing with all the things happening in healthcare today. We're going to take a quick break. Much more with Ginger in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Ginger Scott, a Chief Nursing Officer at the Community Health Center. Ginger, tell us, can you give us an example of how Community Health Center is kind of going for those goals you spoke of previously?
So with support from one of our local CCOs, Jackson Care Connect, we've been able to hire what we call a non-traditional health worker. And this is somebody who works with patients on a one-to-one basis. And she really is able to engage them as partners in their care so that they can learn how to take better care of themselves. Okay? We are fortunate to have Linda Larson in that role at Community Health Center. And she's actually added to our care team so that she is working with the care teams to identify folks that can benefit from some hands-on support to stay well.
Okay.
And I can give you a great example.
Please.
So Linda's been working with a single mom who has a daughter with asthma, and this child was showing up regularly in the emergency department. The barriers that this family faced, among the barriers that they faced, they had no transportation. They did not have stable housing. They were essentially homeless. They didn't know how to access services after hours. With Linda's help, the mom was able to access community resources. They have stable housing now. Linda provided the mom with a list of pharmacies that deliver, so they won't be at risk of running out of the medications that keep the child well and keep her out of the emergency department.
Wow.
Linda was able to help the mom really produce a clean environment, clean meaning that there aren't asthma triggers like dust in the environment. The child hasn't been to the emergency department since.
Wow. Incredible. And that's just one example of the type of things that are going on.
That's right.
Very good. Okay, and people can find out more on your website, correct?
That's right.
Yeah, communityhealthcenter.org?
Yes.
Very good. Ginger, great to meet you. Thank you so much for coming in.
Thank you.
All right, stay with us. We'll be right back.